Welcome back to Healthy Communities News. I'm Hilary Russo. For many residents of Harris County, getting sick is more than an inconvenience. It can be a real financial crisis. But the Healthiest Communities rankings, published by U.S. News and World Report, helped us find a beacon of hope. These rankings led us to the San Jose Clinic in Houston's Midtown neighborhood. Founded in 1922, the clinic has served members of this largely Hispanic population for nearly a century.
When I was a kid, I remember visiting the clinic with my mother, my aunt, and my cousin. Of course, back then, the clinic was in an old wooden house.
Today, the clinic offers a broad range of health services to more than 4,500 patients a year.
We see patients that live at 250% or below the federal poverty level. They just don't have the financial resources to purchase health care or dental care.
I hadn't been to a doctor in probably 20 or 30 years. I don't have insurance. I couldn't even walk 100 foot without getting tired. My aorta needed to be replaced. When I released from the hospital, they told me I had to go to San Jose Clinic. And they've been taking care of me ever since.
We are really blessed to have a whole lot to provide for the patients.
We have a medical clinic, the dental clinic, and we have a Class A retail pharmacy. We also have been able to integrate mental health, and all of those are provided and supplemented by volunteers.
San Jose Clinic has over 700 volunteers. About a third of them are in the medical arena. We're talking about doctors, nurses, nurse practitioners, dentists, pharmacists. We have a nice mix of young professionals and more experienced. Many of them have been here for years and years, some of them over a decade.
They know our patient population. They know the struggles.
They got a lot of heart to them, all of them.
This population is quite vulnerable and pretty challenging to work with because there's so many barriers to care. 80% of our patients only speak Spanish.
The fact that the volunteers can speak Spanish means that there's one less person in between the provider and the patient. Less room for error.
This population was especially vulnerable when the pandemic struck earlier this year.
Lots of the patients we see hold jobs that are blue collar. I mean, you cannot do it virtually. There is a lot of anxiety, a lot of depression that got worse through COVID.
COVID-19 has really brought to light what San Jose Clinic has known for 98 years, that there are pockets of health disparities that are so difficult to overcome in our community. We did what we have always done and stayed true to our mission, and that is to serve individuals in a time of need. We converted our pharmacy to a drive-through.
Good morning, Ms. McGowan.
Good morning.
We took the patients that needed immediate follow-up and started making phone calls.
We realized that if we're able to do telehealth, that would be huge.
Thanks to the CVS Health Foundation, we received some funding to implement a full virtual telemedicine platform, and it's working very well.
Funding from the CVS Health Foundation also helped the clinic establish a satellite location in rural Fort Bend County.
The secret to San Jose Clinic's success is keeping the patient first and then wrapping that patient in their arms with volunteers and partners and people in the community.
Administrative and clinical?
It's not a high-paying job, but it's one of those that you feel is why you became a physician in the first place. The gratification that one gets, there's nothing like it.
At a basic level, it's about love of your fellow human being.